Dr. Cabrera, thank you so much for taking time out to sit with me and speak with me about the state of our island. I know you're busy, so I'm just going to keep it nice and short. I just wanted to get your input on Guam's current status on path to half. Where are we with that?
So we're actually in pretty good position overall in terms of getting 50% of our adult population, and again, adult being defined as 16 and over, fully vaccinated. So we're really doing good overall. But this also depends on those who are due for their second dose to really come out and get your second dose when you're due, and especially because of the current pause of the Johnson and Johnson vaccine. So we highly encourage everybody to ensure you get fully vaccinated and don't just get the first vaccine for the Moderna and Pfizer.
What are the numbers looking like? How far away are we from 50%?
So when you look at all vaccine efforts on the island, and when I say all vaccine efforts, I'm talking about government of Guam, private sector, and Department of Defense, who vaccinates also active duty civilian workers, and as well as beneficiaries and contractors. You put them all together, and we're approximately 43.1% away our current vaccines for adults. So we're pretty close. We're, again, our goal is to be 50%, and by May 1st or so. And we're well on our way, and that's even without using Johnson and Johnson. If Johnson & Johnson gets unpaused and we start using them for the last week of April, then we'll be even in better shape. And we may even hit the target before May 1st.
So we're 11 days away, and what is it? 7% away from 50%. Do you think that we'll be able to meet that 50% by the deadline May 1st, or the goal May 1st?
Yeah. So I think first and most importantly, that we have to also remember that this was May 1st was just a nice round number, so to speak, and that it was arbitrary in a sense, but it gave us something to shoot for. And so whether we get there a few days early or a few days late, in the end, it doesn't have that much impact on our overall goal, which is getting to actual herd immunity, which is closer to 80% of the population. So that being said, we are definitely, are on the right track, and there's a chance that we may even hit it toward the end of April, and so a few days short of May 1st.
Okay, so by the rate of what it's going, you guys are actually expecting it to be achieved before the May 1st deadline.
Yeah, that's being optimistic, of course, but it is realistic also. In terms of what the numbers are bearing out for us, and those who are due for their second dose before May 1st, and so that's reassuring. And again, there's the FDA and CDC, they're going to be meeting again on Friday, which would be Saturday our time, and to determine what's the next step with the Johnson and Johnson vaccine. And in all likelihood, it will be unpaused after that meeting. But there may be some extra precautions that are mentioned with it, or even as much as some restrictions. So that remains to be seen. But I think there's a good chance that by next week, we'll be using the Johnson and Johnson again.
Okay. Well, it sounds like everything has been good news so far. We're ahead of the game. Do you think that then this would mean that Guam could be looking at also going into PCOR 4 when either before the May 1st deadline, or when we reach that 50% mark?
Yeah, and so PCOR 4, we, how we defined it initially, especially early in this pandemic, was really going back to complete normalcy. As we know it, as we've known it for the past, several years prior to all this. And so that's really what PCOR 4 is. And so the 50% mark is not to get to PCOR 4. Really, what gets us to PCOR 4 is that 80%, approximately 80% herd immunity number. And so again, that could be arranged between 70% and 90%, but that's why we're just going in the middle and just saying about 80%. And that's the goal for prior to Liberation Day. That we're shooting for as well.
I see. Okay, thank you for clarifying that. I also wanted to get your thoughts about the increase in positive cases. I believe, um, and I could be a little off, but I believe that the number was 20% increase within the past couple of weeks, days.
Yeah, so again, our car score now is at 0.5, and when we had it around 0.2 for a very long time, and also 0.1, it's like it's more than double, right? But what we have to remember is that we know what a car score that's above 2.5 and above 5, what that ultimately means for hospitalizations. At least when looking back retrospectively, for much of the summer, we had our car score at 1.5, and for a while, and there was only like 0 to 2 COVID patients in the hospital. So in that perspective, but now with so many of our especially vulnerable population already been vaccinated, we can potentially even have a much higher car score and not the same amount of hospitalizations. And so that's the whole point of the vaccine. And so we're in better shape overall. So I'm not too concerned about the 0.5. The other thing to be very clear is that over the past 28 days, all the positive cases we had, 45% of them have been identified in the quarantine facility. So these were travelers. So these never made it out. But these are 45% of them, or approximately 44 of the travelers. Those are 44 potential clusters that we've been able to prevent. And so, when we think about what's actually in the community and what's the actual community spread, it's still there. It's still happening. I don't think we'll ever eradicate it. And especially if we want to have some trade-off in terms of our liberties.
And I think that what you just said there actually clears up a lot of things for a lot of folks because, it is something that we're also trying to, get the word out there that many health officials have been saying that this, like the flu, is pretty much something that is going to be around, and which is why it's so important to get vaccinated. It's keeping the hospitalization numbers down. So obviously, the higher that people have been getting, the more people getting vaccinated, our hospital numbers have practically remained, very much leveled with that. So if you could just give I guess those that haven't gotten vaccinated for whatever reason, what can you say to them to really encourage them to take advantage of all the vaccination clinics that have been set up?
Yeah. So again, what are the things that we're looking at first for the first step, right? With the 50% of the adult population getting vaccinated, what does that mean? So one, then that means a change in our travel quarantine protocols. We are looking at a drastic change, in fact, and that's because our risk, when you get above 50%, our risk tolerance goes up, as in we can tolerate more risk. And so that's a big incentive and a big reward for the entire community. The other thing is that we can, when we're above the 50%, now we're not in a more vulnerable state, just being in a remote island here, is that we can now actually adopt some of CDC's more liberal guidelines. And so, and this has to do with those who have been vaccinated and whether or not they need to quarantine or not. So we get closer to that and being able to adopt that, because right now, we're still, quite concerned, and in terms of what that might mean if there was some more spread on the island. But with more people vaccinated, the more we get to have these liberties. So that's really important, and it's something that we should all, really strive for.
All right, thank you so much, Dr. Cabrera. And just lastly, is there any word on the variants that were sent out?
When we got our results, when it came around, it was at the exact same time that the CDC was releasing their definitions of variants of concern, and some of and how they were listed. And so we haven't had any results since then. But we anticipate probably when they're going to make a adjustment to that list, that probably also be around the same time that we're going to get some results back as well. So we're still waiting. We check every day, and we get and so far no different word.
We did. What were those couple of cases that were found 3 months ago? Those weren't variants of concern. Those were what did they call them?
They are variants of concern.
Okay.
Yeah, they were variants of concern, and that was from the California strain, and so that is listed in the CDC types of variants that are fit in that variant, that category of variants of concern.
And no further spread since those initial ones, right?
Correct. And so we don't have any other epi-link from those cases that are continuing, that we haven't identified otherwise.
Okay, excellent. Thank you so much for your time, Dr. Cabrera. Is there anything else that you would like to add before we close out?
No, I just really want to thank the community for really coming out. I especially want to thank the 16 to 29-year-old age group. You guys are rocking it, man. You guys are coming out and really doing, and really you're the one group that's getting the most vaccinated right now. You're blowing away every other group, and I can't be more proud because, I'll be honest, this group was the one that we were worried about, and there's still a lot of you that still need to come out and get vaccinated, and we hope that you do. And remember that this is not just about you, this is about your community and protecting everyone. And we all have our part in our role.
What are the numbers looking like with the 16 to 20-year-old group as opposed to everyone else?
So they are, and so about just over 10% of them are fully vaccinated, but they make up a big part. You're talking about 38,000 estimated persons in that age group. And so already 10% are already fully vaccinated. Of course, they were on the tail end of the whole efforts, since we've opened up the eligibility. But every week, they are the group that is by far being vaccinated the most. And so that's been really great to see, overall. For example, since for the month of April, 16 to 29-year-olds getting their first doses, it's almost 4,400 of them. And then the next group after that is the 30 to 39-year-olds. And there's about 2,300 of them gotten their first dose. And so you can see the difference. And then 40 to 49, you're looking at about 1,900 of them getting their first dose since April 1st. And so that's, that really speaks a lot, that they are the biggest group, but they are coming out in numbers that they're doubling or tripling the other age groups.
Wow, that's very impressive. Well, what do you think why do you think that might be? Why is it our younger ones that are making up the highest vaccination rate?
Well, I think it's two things, right? I think it's one that they don't want to be vulnerable, even though they feel healthy. But number two, I think it's that they understand what life here on Guam really means, and that we take care of each other, and that we watch each other's sixes, and we do this we do a lot of things for not just ourselves, but for our families. And I think a lot of them have, older family members that they want to protect. And I think that's honorable that they're doing it because of that. If they don't have any other reason that they believe in, at the very minimum, to protect those that they love, which is, again, very honorable.
All right, excellent. Thank you so much again, Dr. Cabrera, for your time. This is a very fruitful interview, I will say. Learned a lot. Thank you. So,
Sure.
Hey, I guess that's why they call you doctor, huh?
Yeah.
All right. Well,
so yeah, sorry we kept delaying this, being able to, but it's been a little bit tough to try and